health ambassadors to mitigate COVID-19 and promote vaccine confidence. We have on the panel Ms. Famika Edmond, also Ms. Patrice Guzman, who have been extremely instrumental in this process. And Liz, if you can expand that to a full view. So with that, Black Girl Health Foundation, if we would, in light of Ms. Grigsby's absence, Patrice, could either you or Famika tell us something about Black Girl Health Foundation? Patrice? Hi.
Hi, good afternoon, everyone. So Black Girl Health Foundation is a national 501c3, and we really focus on providing education in terms of health to women across the US, especially women of color, just to ensure that they have resources and information available to them. So for this particular project, we worked with our College Ambassador Program to help provide education in the college communities around COVID-19. I see Portia has joined, so I will let her take over from there.
Thank you for joining us, Portia.
Yeah, thank you so much. It was hard trying to navigate this this system here with all the breakout sessions. This is a first for me with doing Zoom breakout sessions. So hi, everyone. I hope everyone is enjoying the panel discussion thus far. So my partner in crime is Patrice, who's already kind of giving you guys an introduction. So that's great. I don't want to be too repetitive, but hopefully she's already given you a summary kind of our campaign. It seems like she's talking about that. Just a little bit about our program, just in general, Black Girl Health Foundation, in case you guys even have questions, we definitely want to hear from you. So during this discussion, anytime you do have questions, please put them in the chat and we'll answer them at the end. I believe Patrice is going to be moderating those questions at the end, but please don't hold back. We want to hear. But Black Girl Health Foundation is a nonprofit organization geared to improving the health of women and girls of color. We do that mainly through engagement, empowerment, and education. Primarily has been done for the last 2 years through our SOUL program. Well, no longer a SOUL program, but was our SOUL program, our College Ambassador program, which Patrice spearheads. So that program, we recruit ambassadors, and you're going to hear from several ambassadors during this call, this webinar. But during the College Ambassador program, we recruit ambassadors from all over the country to be health leaders in their own communities, and they help us and our staff to orchestrate community health workshops and campaigns to spread awareness about chronic issues that are disproportionately affecting women and girls of color. So we have a maternal health campaign, which we call Superwoman. We have a mental health campaign, which we call Minds Matter. And we have a breast cancer campaign we call I'm a Survivor. So those ambassadors are working on those campaigns. They're touching, they're communicating with potential patients, but they're communicating with our target audience. They are getting them to come to the workshops. They're getting them in our funnel so that they can receive ongoing information about that particular topic, about the signs, the symptoms, and different solutions on how to protect themselves or treat themselves. So our ambassadors are very valuable to the operation of our organization. And with the campaigns that we already do, this year we added on Stay Focused, our COVID awareness campaign, which we partnered with Morehouse, with you guys, to be able to spread awareness about protecting particularly the African-American community from the virus. And so as Patrice was mentioning, we recruited 20 ambassadors from Tennessee and Atlanta to work on this Stay Focused campaign. And mind you, we called it Stay Focused because with all the distractions that are going on in the world and post-pandemic, it's very easy for people not to forget about COVID, to forget about protecting themselves, thinking that they're all good. So we wanted to encourage people to stay focused on protecting themselves. Don't let their guard down just because it seems like things are sweet. So during this campaign, we charged our ambassadors to do a TikTok series, since we know that TikTok is kind of the way, the new wave of social media right now. This is where young people are on TikTok. We thought it would be a great avenue to reach this particular population, and it has been great. We've gotten hundreds and thousands of views with our ambassadors that we recruited in Tennessee and in Georgia, doing these different TikTok videos to keep the viewers kind of focused on the main thing. So they do all these different distracting videos, but in hindsight, we want them to keep them focused on COVID. So during these videos, there were facts and stuff displayed about COVID and protecting themselves. We even used the videos as a lead magnet to get them, so we could get their information, their emails and all that good stuff, so that we can retarget them with information about where they can, get vaccinated, or where they can get more information on how they can protect themselves on just a daily basis. So that campaign did very, very well. Not only, did we get a lot of traffic with the videos, our ambassadors were able to physically touch people and communicate and talk to people and get their emails as well. In the community, they were able to go out in the community and talk to people about the Stay Focused campaign that we're doing, so that we can constantly give them information on how to protect themselves. So with that said, I would love to get started with our panel discussion. And I believe we're going to start with our ambassadors. We're going to hear from them what exactly they did and how effective they believe it was, what they heard from the community that they were serving. So I see Kamal is on. Kamal, won't you just jump right in for us? Won't you jump right in for us and talk about how, this, this time with Black Girl Health Foundation went for you in participating in this campaign?
Yeah, so hi everyone, I'm Kamal Siddiqui. Since my time is brief, I'll get right into it. So working with Black Girl Health Foundation, it was overall a great experience. Not only were we sharing tips, resources, keeping everyone updated on this pandemic, the information itself was very engaging and easy to follow. And something that I really loved was that Black Girl Health saw, as said earlier, that TikTok especially can be a powerful tool for disseminating health information and that awareness about everyone I know in my circle, from college students to even older adults. They watch TikTok videos. They may not have the TikTok app downloaded, but a lot of TikTok videos are, shared on Instagram and on Facebook. Like my mother will forward me TikTok videos she saw on Facebook, and I'm like, oh my God, because I'm like, oh wait, did you download TikTok? And Mom was like, no, I don't know how to use that. So all this information is being disseminated in a way. And so TikTok is extremely viral right now. So why not use it in spreading proper information about COVID? So when I was on my college campus talking to students and teachers, it was great being able to say, oh yeah, follow us on XYZ to stay updated. And I felt that they were more engaged and continued to stay engaged. Not only that, but by talking to students and from noting their hesitations and concerns, I was able to create my own content based on that. And I follow the CDC and the WHO to stay informed, but oftentimes their information is too generalized and not centered to a specific audience or community. But by being a part of Black Girl Health, I was really able to make localized information that I knew my community wanted to know more about, and ultimately improving that vaccine confidence. And by using college ambassadors to create TikTok and other social media content, I felt that was really smart and innovative from my point of view. And last thing, my favorite thing about working with Black Girl Health was that during these meetings, I also just got to talk to other Georgia college students from different universities like Tech, Kennesaw, Emory and how their school specifically handled COVID. And it was just crazy to hear how it was so different from university to university. And these are all, universities in Georgia. So by having these conversations, we really could come together and form better solutions together. And I'm still following Black Girl Health and like all their socials. And I can't wait to see the growth and continue to see the growth that they create when it comes to health literacy. So yeah, that's it from my end.
Thank you so much, Kamal. Kamal was like one of our, oh my goodness, she definitely took this very, very seriously. And she was like one of the highest ranking ambassadors that got like the most emails and clicks and all that good stuff. So I thank you for being a part of Black Girl Health Foundation and helping us with this campaign and helping us reach the people that we needed to reach. So you did a fantastic job. So let's carry on. Chinarelle is the next ambassador who worked on the Stay Focused campaign. There you are. Awesome.
Hi. Hi.
Yes, go ahead and take the floor.
Okay. Hi, my name is Chararia Coward. I am now an ambassador for the Morehouse School of Medicine. Previously one for the Black Girls Health Foundation. I attend Clark Atlanta University, and I'm here to explain my experience with the Black Girls Health Foundation, which was my very first, I can say, internship. Oh. And COVID was something that was really important to me because I had a grandfather that passed from it. So being part of something that I can help encourage people to get vaccinated, booster shots, it was something very important to me. I made sure that I did everything I was supposed to do, make sure everybody got their emails. Our meetings were very informative, especially attending we had a program where we had to complete to get our certificate, which gave me a more thing when I go out and talk to people when I outreach. I can show them my certificate, meaning that I'm really informed to let you know why you need to get the vaccination, why is it important. It can help you, not just you, and others as well. And I just feel like other people don't really realize how important it is to be vaccinated now that a lot of people have passed from it. But going to school, I made a TikTok video about the reasons of why you should get COVID vaccinated and how it affects HBCUs and colleges in general. They stop you from doing a lot of activities, events, and everything else due to the fact people are not vaccinated and putting people's safety in danger. So overall, I just feel like being part of the Black Girls Health Foundation, it was good for the outside when I talk to others. Just sending them my postcard, letting them know that being vaccinated is very important, not just for you and for others, but overall. And one of the most important things that I did with the Black Girls Health Foundation is make sure my stuff was on time, make sure everything was informed. Like our weekly emails, we had to send out emails every week. And you had to make sure everything was on time. Far as in, we had another event that we had did with the Morehouse School of Medicine. But to me, I just feel like both of them are very important and altogether. I'm so sorry. They're both important altogether due to the fact that they're both helping the world with being safe, clean, and overall protected. And that's all for me.
Well, thank you so much. We definitely appreciate you being a part of our organization and taking the time to do all.
Thank you for the opportunity.
Yes. Oh, yeah, absolutely. And there may even be more opportunities. And that's the thing about, being with Black Girl Health and being involved in our ambassadorship. Whatever campaign that you're working on, there's definitely opportunities for growth and working on additional campaigns. And even career pathways for us to help you in whatever career that you're seeking to get to that endpoint. So this is not just a one-time thing. We definitely encourage ambassadors to come back to us. So thank you for all your work. Thank you for the TikTok videos. So we really appreciate that. So moving right along, let's go to Patra.
Hi, how are you?
I am doing well, Patra. I cannot wait to hear about your experience with us. Please take the floor.
Hi, yes. Hello, everyone. My name is Patra Williams. I am currently in school still. I'm a senior at East Tennessee State University. And I'm here to just talk about really quickly about my experience with Black Girl Health. And I personally feel like this was a great opportunity. It was a very successful campaign. It brought awareness to vaccinations, booster shots, and just keeping up with the proper guidelines and continuing that with young adults. I'm currently majoring in health sciences, so this was a great opportunity for me to be able to take what I'm studying and putting it into action. We did a lot of community engagement, as you've heard earlier. We did that through social media, through the Black Girl Health Foundation platform, and we used our own social media platform. So I think that was very helpful because not only were the people who were following the campaign, but people that we know personally were able to follow along with what we were doing. A few of my favorite things from the campaign was probably creating the postcards and the flyers. Being able to show our work to our community was probably the highlight of this campaign for me. Also, being able to just interact with college students through the COVID-19 pandemic, it wasn't hard. It was just, you had to be aware of what you were doing, which I think was great. Being able to go out in the community, but still staying safe because, you had to practice what you talk about. That was also a major factor of the campaign. And it was just a great experience overall for me. I did it throughout the summer months going into leading into me coming back to school. So I think that was really helpful for me to stay engaged with my health and wellness. And I don't want to go too long, but it was just really informative to me. We were able to create digital content, which was excellent. Just getting experience as well and be able to talk about booster shots, vaccines, and everything that we should still be talking about with young adults, because we tend to see we slack off a little bit, I will say, as young adults. So I think the TikToks and the postcards and all of that was a great way to get things going and talked about with our young adults.
Well, thank you so much, Patra, for your participation. And I'm glad that it had an impact on your own life and your own health and wellness that you mentioned, to take that seriously and being proactive. And that's what it's all about too. At Black Girl Health, we definitely empower women of color to take control of their own health. And with all our campaigns that they work on, the ambassadors work on, I hope, and it seems like this did, I hope that executing these projects and helping others empowers you to even, pay attention to your own life and how you're living. So thank you so much, Patra. We appreciate your time.
Thank you.
So moving right along, Famika is our college ambassador program assistant, followed by Patrice Guzman, who is the manager. So both Famika and Patrice work hands in hand with this campaign to make it all happen. So it would not have been so fluid and so successful without Famika. She's recruiting all the ambassadors and talking to all the ambassadors and making sure that we get the right one, because I know we got a load of ambassadors. We had definitely a lot of wins, and we had some challenges as well. So Famika can talk all about that, and Patrice, so I'll give you guys the floor.
Okay, thank you. Do we have another slide besides this one? Okay, so we're going to jump into the project report about the COVID Ambassador Program. Thank you.
Awesome.
So I'm going to turn it over to Patrice. She's going to do a quick overview, and then I'll get into some of the logistics about the program.
So through our presentation today, we're just going to give just a brief introduction on Black Girl Health, the role that our organization really played and the purpose of our part within the program. Just discuss some of the deliverables and our strategy and how we went about executing that. And then we'll discuss some of the accomplishments and challenges that we faced throughout the campaign. So as we've kind of mentioned, we are a 501c3 that creates pathways to improve health for Black women and girls through education, engagement, and empowerment. And we utilize our college ambassador program to really connect women of color and to give women of color education and resources to share throughout the community, and help hopefully change some of the behaviors so that they adapt to healthier lifestyles. Next slide, please. As was mentioned, we were tasked with recruiting 20 ambassadors from the states of Georgia and Tennessee. Our ambassadors served a dual purpose. First, to provide underrepresented Black females and communities with trusted Morehouse School of Medicine and HealthWorks information, and to promote disease prevention and education. But it also helped lay an educational foundation for the ambassadors to build upon. We really did focus a lot in our recruitment with trying to get ambassadors that had a focus in health, whether it be public health or in the healthcare space, so that they could utilize this experience for future endeavors as well. So just about some of our deliverables. So we've mentioned our Stay Focused campaign, and the ambassadors really did a great job overall putting together these really distracting, very entertaining and creative videos. Their messaging included facts about protecting themselves, the community, but also discuss some of the myths that go along with COVID, vaccine hesitancy, and things of that nature. And it was just really amazing to see how creative the ambassadors were with putting that information together and really highlighting COVID while still being engaging. So definitely bravo to them on that. Their additional outreach efforts included creating digital and printed postcards that were promoting COVID awareness, facts, guidelines, and information about mobile vaccination clinics in the area. The content that was put together was very professionally done and disseminated. We disseminated several postcards through the week and continuing up through this week to still put out information regarding the campaign, but really well done, really great information. And they really tapped into every aspect that you could think of. When the monkeypox came about, they found ways to kind of integrate that into the discussion. They really promoted, when kids were going back to school, the importance of pediatrics and getting that group vaccinated as well. So although our focus was really in that college community age, we really did try to tap into everyone within the community with the resources that were developed. Next slide. So the newsletter dissemination, as the ambassadors mentioned, they were tasked with going out and collecting emails within their community. And with that, we would do a weekly newsletter where we featured an ambassador, their TikTok video, along with an article that they wrote that kind of aligned with the messaging that they put into that video. So we were able to collect almost 1,200 emails through the duration of the campaign. And that's who we were disseminating these newsletters to, as just a way to keep those individuals informed and engaged, and just up to date on the current status of the campaign, or if any new really relevant information came out, or where vaccination clinics were taking place within the states of Georgia or Tennessee. So the newsletter was definitely a vessel that was very helpful with continuing to engage people even after they've had those discussions with the ambassadors. I'm going to actually turn it over to Famika at this time so that she can kind of go into some details about our recruitment strategy and how we worked with the ambassadors.
Thank you, Patrice. So some of the efforts that we use to be able to recruit the ambassadors, we use Indeed and the Handshake platform. The appealing job post on Indeed promoted to find qualified candidates, utilizing the Handshake platform that connected Black Girl Health Foundation directly to universities in Tennessee, Georgia, and students looking for outreach, community outreach opportunities. Our ambassador recommendations, ambassadors recruited early on in the program also were referred by peers to be interviewed for the position. Between the two platforms that we use, Indeed and Handshake, I found that Handshake was more effective in getting the type of individual prospective students that we have wanted for the campaign. Many of the students that I was able to go in and select their majors. So many of the girls either majored in something in health or were doing something in public health. So you were able to do that kind of search. Whereas Indeed really did not give us that type of ability to do that. But those were some of the efforts. Word of mouth, Indeed, and Handshake were like our main. And then also we had HealthWorks. They distribute for us in Tennessee some flyers when we needed more assistance with getting ambassadors for the Tennessee area. Next slide, please. The ambassadors have collected about 1,200 emails for the purpose of sharing information about the campaign through the Black Girl Health newsletter. Also, the ambassadors developed and disseminated over 75 unique promotional materials about the campaign through social media, across their campuses and in their community. The ambassadors also developed engaging and creative content that was shared through Black Girl Health TikTok platform, as Patrice has stated. And a lot of the work the girls have done was amazing, and they did a really good job. Next, some of the challenges though we had faced was the canvassing, training, launch delays. With us not having the training links and stuff available to us, like with our first cohort, since we had started on May 1st, many of the girls, we had to get back with them so they can go ahead and get their training. So I think if the training had been available a little bit earlier, things could have been a little bit more cohesive as we went through each of our cohort. Retaining ambassadors once they were onboarded, that was very difficult. Many times we were able to get the amount of girls that we needed, but being able to maintain their attendance during the campaign was very difficult. Some of them did, life events came up and they weren't able to continue on. Some of them took on a little bit too much with school, especially going towards many of them coming into the September month. Many of them had to, streamline their school schedules to be able to finish their commitments. And also, Georgia versus Tennessee, this was another challenge we had, with recruitment. We ended up having more participants than we did for Tennessee. So at one point at the beginning, we did have an equal amount of people for Georgia and Tennessee, but that, again, with the retention, we weren't able to retain those individuals or get those individuals to
Portia, you're on mute.
Sorry, I hate when I'm just talking and I feel like you guys are hearing me. I apologize for that. But no, I was just saying thank you so much, Famika and Patrice, for giving that synopsis on our campaign, the pros and the challenges. With every campaign, there's always challenges, but it's how you adapt and work around those challenges. And for us, even though we definitely had people, we got a lot of people who were interested in not the stability, you know, for some of those, for some college students, we were able to still, you know, bounce back and you know, make sure that everyone, and get the proper number of ambassadors and making sure everyone sees it through and do all the assignments, you know, required, and to meet our ultimate goal. So definitely happy about all the participation that we got from all the ambassadors who took the time to, you know, dedicate their time in making sure that our campaign was successful, which it was. Thank you both, Patrice and Famika, being able to hit all those goals, 1,200 emails. I know this was all hard work, and training all these ambassadors and make sure that everyone does their videos and stuff. So I appreciate you both for doing that and managing that whole process, because I know it could, you know, there were tough times, but we did it. So thank you both. All right, so moving right along, now we will get to community engagement. And so community engagement, let's see if we have, do we have Alicia? Let's make sure that we have everyone that's, I think our community engagement is with Alicia. I don't know, I don't see her on the call. Oh, there you are. I guess I don't hear you.
I'm here.
Oh, awesome. Awesome. Okay, well, great. Well, if Alicia, if you could go ahead and take it away for us. If you can hear us.
I'll be glad to. Oh, thank you so much. Thank you so much. It's been wonderful listening to this, the ambassadors, the students as ambassadors, the college students. It was excellent. And I thought I would give you a different perspective, however, of coming from the city, the place in New York that was the epicenter of the COVID-19, and how we begun to engage communities utilizing the skills and the services of students. You can go to the first slide. I put this up here so that you could see what we saw in my college, Lehman College, and where I am given the exemplars and building for you what it is that we did and how we were able to engage the students. Next slide. Oh, I could do it myself, sorry. So if you would bear with me, I want to identify a process that we've used for many years to engage students as health ambassadors, not just for the COVID-19, but rather in COVID-19, but in other diseases found throughout African American and in our community of the Bronx, Latinx. So, oops, I went back too far. So here's the process that's used. For those of us in community and who've worked in community health, we understand the process of mapping community assets. Some of you may call it community assessment. We call it mapping community assets. So as we started the process, because this has been ongoing with students in our program, this is a nursing program, a baccalaureate program, where students have the opportunity to get into working in community, working as ambassadors, going into communities and leaving the communities better than it was before they got there. So when you understand community mapping community assets, you know from community health that we're going to use a strengths-based approach. We're not going to look for deficits. So our goal in working with students in, and again, nursing department, was for them to really have a sense of documenting what existed in the community. What were the resources that were there? What were the strengths that they could find? But also with this, the students were also expected to be able to look at their own personal assets. What did they have? What did they need to be able to be ambassadors to communities and to fellow students? So the other important thing that had to be emphasized was the importance of a human interaction.
Mhm.
This was especially emphasized because when you're asking for people to be ambassadors, not only is the community looking for, quote, someone who's an expert and will bring skills, but someone who could communicate with them effectively using language that they understand, and so that they could get something out of it. So that's the first piece that we use. The other was, how do you connect with the appropriate agencies? Well, if we all remember March 20th, 2020, all of us in New York shut down. I mean, every place was closed. Our hospitals, you couldn't get there. All our students were removed from the institutions. Our colleges closed. The places we were providing services to over time were closed. So it was then having to work with the students to how can they connect. Again, in the beginning of the pandemic, how could they connect with the appropriate agencies? Remembering that if one is involved in community engagement, because during the pandemic, many of them closed, it did not stop the fact that they still needed services. So some of the things that ended up happening was connecting with these appropriate agencies using social media and using a low-tech piece called the telephone, in calling and connecting with communities. Based on that, based on what we knew the community needed, based on what was going on in large cities such as New York, based on where we were not able to provide the services we had done in the past, we still knew that we needed to connect with not just our agencies we had been providing services to for years. So we began to look at what can we do? How can we set up so these students, one, remember we're in a practice environment. Students, we didn't want students to lose their skills of communication, how they could motivate each other, motivate the people that we're providing services to. So then we began to see and how we would set up the program. So here's what we did. Here's how we got the students involved. Now, we're talking about 2020. Vaccines were not available. Students were not, we were not on the campuses. Our campuses were literally shut down. And so what would we begin to do? Well, one of the things we did is through the nursing society, we get the students to have direct communication with their fellow students. In talking to them about what was going on, keeping in touch with them to find out who has been affected, who may have been infected, anybody or any services that could be provided to them. Were they in need? Now, what I'm describing in the Bronx, which is one of the poorest counties in the entire United States, and we provide, and our college sees that in our student body, is fellow students being able to connect with other students because there was food insecurity. And those students then had to be able to be the ambassadors to the college, to other agencies, to be sure that their fellow students were able to have to eat. They also were working through services that were available, again, through FaceTime, through Zoom, in getting students who were really very affected because family members had died or were very ill or themselves being ill, to be able to connect with mental health services. Students led that charge. Students from nursing led that. They got in touch with other students to make sure that they knew what was going on. Fast forward to 2021, when I required our students to come back on the campus for part of the time. In preparation for them returning, the university had a rule: all students must be vaccinated. The hospitals and clinical agencies that were still open, all students had to be vaccinated. Well, if you want to talk about misinformation and trying to dispel myths, this occurred. It was rampant in our college students across our college. It was rampant. Our students began, again, I don't think it's high tech, began to use what I found out then everybody was using was WhatsApp. Those students held sessions with groups of students, talking to them, dispelling the myth about what was in the vaccine and what the vaccine could do for them. And they encouraged students who had made their decision they were going to drop out because they did not believe in the vaccine, and convincing them to be vaccinated. We had a very low attrition rate out of my department, which was the nursing program, of students who were dropped from the college because they refused to take the vaccine. So that's another way to get students through. I listened in on some of the chats the students were having. I didn't have to say very much. You know, they were so convincing. They were so passionate about what it is they were saying to their fellow students. Also, at the same time, as they began to return to the college, they worked with our community partners, those agencies, those places they had been engaged with prior to the pandemic. And what they did, again, they used and they emailed to them the telephone numbers of the people in the community who could not get to services. And those students called them up. Those students talked with them. They encouraged them and their family members to make sure that they went to the places that were now available for them to receive the vaccine. They were so great in how they encourage, again, because of all the myths in our borough, in encouraging people to get out and have the vaccine. Another big issue in how involved they were in the program is as they were able to get back out into the clinical agencies. And as I said, one of the key things about mapping assets is knowing what you have and what you need. Some of the students were not that skilled in giving injections. So we had faculty members who taught them and made sure that they became experts in giving the injections for the vaccine. So they worked at vaccination sites over and above the number of hours they were required to put in for clinical hours. They worked at registering people, bringing people in, and also administering the vaccine. One of the key things in all of this is understanding what it is that these students really, really ended up getting from this whole experience. The experience was that they knew that they had skills and they did become experts for that level that they were on as ambassadors, as student ambassadors to the community. They were able to really feel and know that they made a difference in in doing something about what had happened, what was going on. So to this day, we have students who, because of what they've done, have moved beyond just COVID-19, folks, because there were a lot of things that the students learned in being ambassadors. There were certain things that came out of all of this. In our borough, the escalation of domestic violence, in that we're seeing, some of the mental health issues that we've all seen in our communities that are the sequela to this whole COVID-19 pandemic. One of the interesting things that happened earlier in this month is a group of the students who they're now seniors, they were juniors before. What they did is they decided that what students on the campus needed and what they wanted to do was to hold sessions on domestic violence, which was also very successful. And in being able to talk to their fellow students about what it means, bringing in, besides themselves, bringing in experts, and they encouraging the students to attend. They also got the students to participate in a fundraiser where they raised funds so that they could give to the shelters. One of the key things here that these students learned is that being an ambassador, a health ambassador, can cover all these diseases and other issues. I think Dr. Irvin talked about that earlier on in a panel this morning, earlier today. It is critical that what we've learned, what these students learn, is that they can be ambassadors, they can motivate, they can be experts, they can share information, not just concentrating on the COVID-19, but rather across the board in helping communities, the community of the college, their fellow students, and communities in which they provide service to leave them better off than when they first interacted with them. If there are any questions, I'll be glad to answer.
And yes, I put a note in the chat. Please feel free if you rather put your questions in the chat, you can do so. But we definitely want to hear from you. Alicia, with all the different college ambassadors you did have, what would you say the challenges were? I know you mentioned that there were people who didn't want to get vaccinated, so I guess that could be a challenge. But what were some big challenges that you remember that you had?
Well, one of the big challenges was because our student body reflected those most at risk, because these ambassadors reflected the communities that were most at risk, the hardest part for them was because they saw the ravages within their own family structure and among their fellow students. And we lost count of how many of the student body tested positive or ended up being severely ill. This is prior to the vaccine. So that was a challenge, what else are we going to say? And then trying to dispel, one of the hardest things for these young men and women were trying to really convince the students that they needed to use the science that they had learned as students to dispel all the myths. The bombardment in social media, people talk about TikTok. Well, some of that TikTok stuff was detrimental was counterproductive. Yeah. And, for trying to get across the message of getting the vaccine. Those were the kinds of things they had to work on. And then some of the older people, the older adults, in trying to convince them that, this was not a conspiracy that was ongoing, because some of our students are not, well, let me just back up and say, many of our students and who were the ambassadors were not born in this country. They were not, we have a high African, Ghanaian, Nigerian, Togo population. We also have a high Dominican Republic and Central and South American, population. So they, even though they may have learned or heard of the quote conspiracies and mistrust in vaccine and clinical trials in the United States that we teach them, they had not been exposed to it. So it was then when they got older people or people that were trying to convince to go and get the vaccine, trying to dispel that was really challenging for them. And we gave them some support. We assisted them, they knew of, and that was a hard, and the other thing was, how can you tell an older person what they're supposed to do when you're only 21 years old and they're 65? That was challenging for them because it wasn't like they were in the hospital or in the, saying, well, I'm the, and there was a nurse behind them as they gave an injection or something. Here they're trying to convince people through telephone, and with respect that they should go and have vaccines. That was a challenge for them.
No, thank you so much, Alicia. We appreciate you speaking about your community engagement efforts and trying to get people to protect themselves. So we appreciate all you do and all you have done with this campaign. Again, Alicia George is president of the National Black Nurses Foundation. Moving right along, I'm going to go right to Kevin Sneed, Dean and Professor at College Pharmacy, University of South Florida Health in Tampa. Hello, Kevin.
Hello, how are you all doing? Can you hear me okay?
I can hear you just fine. Thank you so much for joining us. I'll let you take it away.
Okay, perfect. So what I'm going to do just very quickly, I think I'm going to share my screen from here, and then we are gonna get going.
Perfect.
And I promise you, I am keeping an eye on the clock, and we're going to be, so I'm going to encourage everybody to buckle up and hold on tight, as they say in the airplanes. So one of the first things I would like to really talk about is some of the work that we did here in Tampa, Florida, throughout Florida, and even across the nation. The most important thing I want you to see on this slide is right there to the bottom left, and it's Reach Up Incorporated. They are a nonprofit organization here in the Tampa Bay area that we partnered with, and because of all the work that they do in maternal fetal work and pregnancy, they had outreach into areas of Tampa and throughout Florida that we just didn't have access to in terms of trying to educate people about COVID-19. I'm the executive director of a organization called Work Group Enhancing Community Advocacy and Research Engagement. And our true mission is really to go out and begin to educate people in diverse communities about clinical research and clinical trials, and then try and connect clinical researchers to these diverse communities so that we can increase participation. And that's our original goal. But when the pandemic hit, I shifted because of my background in immunology and microbiology and began educating the African American and primarily the communities of color, but it really expanded around the country. So very quickly, just about We Care, again, just showing a big part of our mission really is to connect people from the community with researchers so that we can get further engagement and making sure, Ms. George is right before me, really talked about, the mistrust. One way that we find that we hope to overcome that mistrust is by getting people involved in the research process earlier. And so that's really the goal of what We Care really is. Now, just for time's sake, I won't go into a great deal of We Care here, but when the pandemic hit, we realized very quickly we needed to do a couple of things here. I knew I couldn't just walk out into any part of any community and say, hey, I'm Dr. Sneed, I'm wearing a white coat, I have a background in immunology, believe what I tell you. We really had to go through a trust building process very early on. And I'm really proud to say, even with today, we've done 145 presentations around COVID. I have personally. Many of them, the majority of them, were done on the Zoom platform with Reach Up Incorporated. But as we began to immerse and really communicate more with the community and get more trust, I told our team that we have to start doing a couple of things differently from what I saw other organizations doing. Number one, we had to really begin to just, we were going to tell the community the hardcore truth. We were just going to give it to them, but we were going to give it to them in bite-sized pieces that they could understand. Number two, we had to make sure that we could help them understand, and we were going to go with the evidence. And then from those two things, I would tell them, I'm not here to convince you to take the vaccine. I'm here to share with you background about this virus, what's in the vaccine, what it will do for you, and what it's going to save you from. And then you'll make a much more informed choice. And so that was really the core value that we brought early on in the process. Now, the only reason I put this in is not to go and give an hour lecture about COVID, but I would tell them, I would start off by telling everybody in the community, no matter what background they had, no matter where they were from, I was going to pull you into my scientific community, into my scientific world. And that's what I would tell them over and over again to start the presentation. I found that was a very good defense lowering mechanism for many of them. And then I assured them that I was going to tell it to them in a way that they would be able to walk away and understand. So we talked about the different variants, but I had to show them what that meant. And so we talked about the Alpha, the Delta, the Omicron, and we continue that to this day. Really just showing people, when you hear something in the news, when you're looking at TikTok or Twitter or whatever you might be looking at, now you'll be a little bit more educated about what the terms are and what it means. And I would explain to them exactly what that was. The next big thing that we did really was begin to dispel their own eyes. I know something, and this is not a political statement, but I know sometimes in politics, we often say, don't believe your lying eyes. But what was happening in the media and everything, all of our images really showed people that were in the hospital, they were coughing, they were being put on ventilators and oxygen. And then we would see them in the hospital bed in the ICU. We heard about people not being able to get to their loved ones in the ICU, and then people dying. What I had to really begin to help the public understand was that the virus can actually travel and damage an assortment of organs, an array of organs inside of your body, and explaining exactly how that could happen, and showing them in great detail exactly what was happening through a series of educational videos that we were able to acquire. And so I found that once I began to help them understand a little bit more about the science behind it, but put it in very plain terms, we were then able to open up a whole new dialogue of trust. And really the Q&A portion of what happened after that was really important. So I did find that there were messaging challenges early in the pandemic. And again, I go back to the how, what, and why. So people knew what it was. They knew there was a coronavirus. They knew that it would cause pneumonia. They knew it could lead to death. How could you protect yourself? Well, we heard about masking, we heard about vaccines, we heard about social distancing. But what the media never had time to do, I often talk about Dr. Fauci. Dr. Fauci never had time in the 3-minute interview to tell you why. And that's where many people, when you can't fill that gap in their knowledge and their quest to understand something, if you don't fill that void with actual true evidence and good information, well, then they're going to fill it in with something. That's part of human nature. That's part of why we as Homo sapiens outlasted the Neanderthals, because we were able to fill in that why from a survival standpoint. We still have it today. And so I realized that we had to do everything we could to fill the why in with good evidence and good information, so that they could make an informed decision about how they were going to live their lives and how they were going to protect themselves. And so then the other thing, I started this this year in 2022, once we got into the Omicron phase and got away from the Delta phase, I was going back and now showing the evidence and showing actual data, and telling our Black and Brown communities why it was so important, what was really happening. Not what one person told you on TikTok is going out talking to millions of people, but what is the true evidence showing? And so, here, I began talking to them about COVID-19. Over a 2-year period, it became the #3 killer of people in the United States. Again, behind heart disease and cancer, but it was really more insidious because of COVID-19, because of how rapidly that death rate occurred. You know, heart disease and cancer can take decades to occur. COVID-19 to rise up to number 3 in the death rate in the country over a 2-year period literally happened and almost overnight. And then I began talking to them about life expectancy and what should we expect as people and here in the United States. And so again, you see here, let me move this. So, you know, again, we started talking about, well, you know, life expectancy for a person in the United States is about 75. Women tend to have a little bit longer, a little bit higher life expectancy. Males tend to be a little bit lower. But then if you look at the far right end, I explained to them how that dip down was almost unfathomable here in this country, because we never expect life expectancy to go down because of all the advances that we have in terms of society and healthcare in our country. And so you see a very sharp dip, again, for total life expectancy for females and for males. And then I would break that down a little bit further. And one of the things I would start off with in terms of life expectancy was really just talking about, you know, take a look at the African American groups here on the far right. And of course, you know, the blue line, I focused and educated a lot of people about what that meant. That was on average for if you're African American, if you happen to be in Asian or otherwise, even Hispanic and white. But then I saw when we saw the dip down, but then when I really began to talk to the community about, hey, look what's happening to the African American community from a standpoint of the death rate and how far down we've dropped in such a short amount of time from a life expectancy standpoint. That really tugged at the hearts of a lot of people. And so, you know, the mitigation strategies, the vaccine, the masking, all the things that we were trying to get people to do became really critical. And this is what I've been showing here, here in 2022. Now, back at the beginning of 2021, I would go back again to the data and I would show, you know, census data. And say, well, how many people live in Florida? How many people in the United States? What are the percentage of the people? And you can see here on this graph, and I would show them, hey, African Americans make up about 17% of all of us here in the state of Florida, about 13% across the United States overall. Then I would show the Hispanic or Latino community as well. And I would just show these numbers and tell them, now, what we should always try to do in almost everything is at least, at the very, very, very least, match what's happening in the census for the United States. So here, I show data and I would update this weekly. I'm just showing you an example of some of the data I was showing again about a year ago when the vaccines began rolling out. So we showed the number of people here in the state of Florida that were getting vaccinated. We showed, and the most important area was the race. Okay, not even the ethnicity overall, but just if you take a look at the racial data. I'll come back to that statement in a moment. So I would show what's happening in Florida, then I would show what's happening in Hillsborough County. And then I would break this out by percentages and I would share with people, you know, we should be up to about 17 or 18% of the population getting vaccinated. And I would show how far behind we were. So we kept hovering somewhere around 8 or 9%. So we worked harder with We Care, especially in the Tampa Bay area, to try and get more people out and get vaccinated. As time went on, and this is again where I would kind of show exactly what's happening, how many people, what was the racial breakdown. And at this particular time, again, just showing an example, I was showing that that African Americans, we were only making up about 7% of the people who had been vaccinated total in Tampa Bay or Hillsborough County. And that we really needed to try and increase that rate, but again, showing information, but then taking painstaking steps to talk about it in a very, very, very culturally appropriate, very understandable lay term, so that people could walk away and understand their role and see what's happening not only in their own life, but people around them. And then I would even show them data according to, well, what's the most common variant and what's happening in the state of Florida. So I would show all this data and I would explain it in very lay terms. Now here, I wrote a article early on in 2020 that really began when I noticed that number one, it was African Americans that were primarily dying the most. Number two, it was happening in New York City. I got wind of things happening in Detroit, and then down in New Orleans, where I trained and did my training at Xavier University. And then I went over and I took a look at the cardiovascular cases. And so that was the early part of understanding that we weren't just talking about a respiratory disease anymore. We really were talking about a cardiovascular virus that was attacking those that had cardiovascular challenges and making them far more susceptible. So to me, it was predictable who exactly was going to be most susceptible. And so I wrote these articles. I wrote 2 of them. I think they're still up online now, as a matter of fact. But I said, coronavirus and health equity, again, this too, or this also is predictable. And so I would go through components of these articles to show them evidence and proof of the fact that we needed to be more cautious about people that had diabetes or high blood pressure, those that fell into the overweight and obese category. Because again, then we would go back and educate about how the virus was exploiting these cardiovascular conditions, turning on a large amount of internal inflammation, leading to people going into the hospital and then sometimes even dying. And I put this in primarily because, and again, I show this all the time, but one of my former mentors, Dr. Keith Ferdinand, a cardiologist with the Tulane School of Medicine, again, back in New Orleans, a great friend and mentor, he was quoted in this particular article that, again, was showing how prevalent it was that African Americans were being the ones that were most affected by COVID-19. And it didn't matter what state we looked at, as you can see here, almost in every case, we outstripped or outdistanced the number of people who were sick from COVID by percentage versus the number of people that were actually in that state, according to that state census. And then I would also pull data, such as the one you see here, really just talking to people about the fact that, yes, we are dying at a rate faster than our Caucasian counterparts. But then I would go back to the fact and say, but there's only 30 million of us, and we're dying at twice the rate as our white counterparts. So when you have smaller numbers dying at a higher rate, that means your communities are being affected disproportionately. And we would talk about that openly. And the great thing about all the presentation that I'm doing here is the fact that we had students that were coming with us along the way at almost all of our presentations, and they were learning how to communicate with the public and learning how to gain their own confidence and cadence even with how to communicate in the public. So just for, this is a very short video I'm just going to share with you from We Care.
Kevin, I don't think we can hear it, and we're supposed to.
Yeah, I just realized. I won't show. I'll move on. I just realized I didn't click the share sound button. But with this particular video, even though you can't hear it, this video was very instrumental in being able to if I was going to talk at a church or a community organization, we would send this video ahead of time so that people would feel more familiar with us, number one. Number two, they would see that we were associated with Reach Up Incorporated that had these wonderful relationships all over the Tampa Bay area and the state of Florida. And then number three, by the time I showed up, either on screen, on a Zoom call, or later on in the pandemic in person, people felt like they knew me, and they would often tell me, hey, I saw the video and I just feel like I know you. So again, another mode of communicating with the public on their terms. Now I'll put this in just very quickly because these are people that serve on my research advisory board for We Care. Down in the lower right corner, that's Dr. Deborah Austin. She's with Reach Up Incorporated. Unfortunately, you see Dr. Adewale Troutman. Many of you may know Dr. Troutman, who is a very famous public health physician across the country, and then Christina Mathis. Both of them have since passed away, but I keep these pictures. I will always show their pictures because they were such an instrumental part. And also at the very bottom, the picture second from the left, Dr. Sharon Andrews, a very good friend, that's a psychiatrist at the VA in Tampa Bay. Her family has long-standing history in the Tampa Bay area, but also she's a graduate of Meharry, and so I thought, you know, with being Meharry and Morehouse today, that it'd be very good to show one of the graduates there. And then the very final slide I have here, well, how else were we showing data? And we would show this data again to the public. Everything I'm showing to you now, we showed in the public and we explained it in lay terms. But we were showing how we were using data to, you know, that was being done from our global positioning global information systems group with our library. That would actually show where vaccines were occurring, where they weren't occurring, where could we do better, who do we need to reach out to in a given area, and find out the hot spots. And so it was another way of showing that introducing technology into many of our African American communities to once again help them understand that we are not here to be big brother, we are here to help out. We want you to own this information, we want you to question it. And again, it was another really great way to kind of show how we were communicating with the public. And so I think that's my final slide. I'll stop there and see if you all have any questions. Oh, this was a very critical picture early on in the pandemic, because it was very critical that people saw that I too was actually getting myself vaccinated, and I wanted them to get vaccinated as well. So I tried to go through that fairly quickly, just for time's sake, but I'll be happy to answer any questions or take any comments you have. Portia?